Navigating Medicare's financial aspects can be complex, especially regarding deductibles and copayments. These out-of-pocket expenses significantly impact your healthcare costs. This guide explains Medicare deductibles and copayments, how they work, and strategies to manage your healthcare costs effectively. A Medicare deductible is the amount you must pay for covered healthcare services before your Medicare plan begins to pay. It's your initial out-of-pocket cost for medical care within a specific period, usually a year. After paying your deductible, you'll typically only be responsible for copayments or coinsurance for covered services. The Part A deductible applies to inpatient hospital stays. In 2024, this deductible is $1,600 per benefit period. A benefit period begins when you're admitted to a hospital or skilled nursing facility and ends when you haven't received inpatient care for 60 consecutive days. The Part B deductible is an annual amount you must pay before Medicare covers outpatient services. In 2024, the Part B deductible is $240 per year. Deductibles for Medicare Advantage plans vary depending on the specific plan you choose. Some plans may have no deductible, while others might have separate deductibles for medical services and prescription drugs. Part D prescription drug plans may have an annual deductible. In 2024, the maximum Part D deductible allowed by Medicare is $545, though many plans set lower deductibles or waive them entirely for certain tiers of drugs. For example, if you're admitted to the hospital, you'll need to pay the $1,600 Part A deductible before Medicare starts covering your inpatient costs. For Part B services, if you have an outpatient procedure costing $300, you'll pay the full $240 Part B deductible, plus 20% of the remaining $60, totaling $252 out of pocket. A copayment, often called a copay, is a fixed amount you pay for a covered healthcare service after paying your deductible. Copayments are typically a set dollar amount rather than a percentage of the service cost. $0 for days 1 to 60 of a benefit period, $400 per day for days 61 to 90, $800 per day for days 91 and beyond, up to 60 lifetime reserve days. Most Part B services require you to pay 20% of the Medicare-approved amount after meeting your deductible. $20 for a primary care visit, $40 for a specialist visit, $10 for generic prescription drugs. Tier 1, preferred generics, $5 copay. Tier 2, generics, $10 copay. Tier 3, preferred brand name drugs, $40 copay. Tier 4, non-preferred drugs, $100 copay. Tier 5, specialty drugs, 33% coinsurance. For instance, with original Medicare, if you visit your doctor for a checkup after meeting your Part B deductible and the Medicare approved amount is $100, you'll pay a 20% coinsurance of $20. Generally, you'll need to meet your deductible before copayments or coinsurance kick in. The typical sequence is, pay 100% of costs until you meet your deductible. After meeting the deductible, pay copayments or coinsurance for covered services. If your plan has an out-of-pocket maximum, once you reach that limit, you may pay nothing for covered services for the rest of the year. The combination of deductibles and copayments significantly affects your total healthcare spending. A plan with a high deductible but low copayments might be cost-effective if you rarely need medical care, while a plan with a low deductible but higher copayments might be better if you frequently use health services. Different Medicare plans structure their deductibles and copayments in various ways. Original Medicare has set deductibles and coinsurance rates. Medicare Advantage plans may offer lower deductibles but higher copayments, or vice versa. Some plans may waive deductibles for certain services or offer copayment-only structures for some benefits. Several factors can influence your Medicare deductibles and copayments. Annual changes in Medicare costs. Medicare adjusts its deductibles, copayments, and other cost-sharing amounts annually. Income-related adjustments. While deductibles and copayments don't vary based on income, high-income beneficiaries may pay higher premiums for Part B and Part D. Medicare Supplement Insurance, Medigap, policies can help cover deductibles and copayments for original Medicare. Additional coverage through an employer or union may help pay for some of your Medicare deductibles and copayments. Some states offer programs to help low-income beneficiaries with Medicare costs. Assessing your healthcare needs. Consider your typical healthcare usage and any ongoing health conditions when selecting a plan. Comparing plan options. Use Medicare's Plan Finder tool or consult with a licensed insurance agent to compare different plans' costs. Utilizing preventive services. Many preventive services are covered by Medicare without deductibles or copayments. Using in-network providers. If you have a Medicare Advantage plan, staying within your plan's network can help you avoid higher out-of-pocket costs. Medicare savings programs. These state-run programs can help pay for Medicare premiums, deductibles, and copayments for eligible beneficiaries. Extra help for Part D. This program assists with prescription drug costs for those with limited income and resources. Health savings accounts, HSAs. If you had an HSA before enrolling in Medicare, you can use the funds to pay for deductibles and copayments. Setting aside funds. Consider setting up a dedicated savings account for healthcare expenses. Do I have to pay the Part A deductible for each hospital stay? A. You pay the Part A deductible for each benefit period, not necessarily for each stay. Can my Medicare Advantage plan change its deductibles and copayments? Yes, Medicare Advantage plans can change their cost structures annually. Are there any services exempt from deductibles and copayments? Yes, many preventive services are covered at no cost under Medicare. How do deductibles and copayments work if I have both Medicare and Medicaid? If you're dual eligible, Medicaid typically covers most or all of your Medicare deductibles and copayments. Potential policy changes. Policymakers often discuss ways to modify Medicare's cost-sharing structure, such as combining Part A and Part B deductibles, implementing an out-of-pocket maximum for original Medicare, adjusting copayment structures to encourage high-value care. As healthcare costs rise, Medicare deductibles and copayments may increase over time. Technological advancements. New healthcare technologies may influence how Medicare structures its cost-sharing in the future. Understanding Medicare deductibles and copayments is crucial for managing your healthcare costs effectively. By grasping these concepts, you can make informed decisions about your Medicare coverage, budget appropriately for healthcare expenses, and maximize your benefits. Remember to consider your total healthcare needs, including premiums and potential out-of-pocket maximums, when evaluating your Medicare options. Stay informed about annual changes to Medicare costs, explore available assistance programs if needed, and seek help from reliable sources when making coverage decisions. By taking a proactive approach to understanding and managing your Medicare deductibles and copayments, you can ensure you're getting the most value from your healthcare coverage while keeping your costs as manageable as possible.
The sun.